Hello, my name is Dylan Nguyen, and today I'm going to be talking about how to prevent and handle a fentanyl overdose. So, on the agenda today, we have four different topics that I wanted to cover. One being fentanyl overdose, two being the signs of fentanyl overdose, three being how to handle a actual situation where an overdose is occurring, and then four, just the importance of drug testing. The reason I want to talk about this today is because over the past few years, fentanyl overdose has become an increasingly prevalent problem. From 2019 to 2021, there was an overall increase in drug overdose mortality with more than 106,000 deaths reported in 2021, with a little over 70,000 of those deaths involving fentanyl. That's a little over 66%, or a little under 1/3 of those deaths being involved with fentanyl. So what is fentanyl? Fentanyl is a potent synthetic opioid that is 50 to 100 times more potent than morphine. And since it is so potent, people will often illegally combine this drug with other drugs that have also been obtained illegally, including heroin, cocaine, methamphetamine, ecstasy, and other opioids. Now I'm going to be talking about fentanyl poisoning. So, what exactly is fentanyl poisoning? Fentanyl poisoning is when fentanyl is illicitly combined with other drugs. This is a very common problem. According to the American Addiction Center that took a look into overdoses in 10 different states, almost 57% of those who died from a cocaine, methamphetamine, or heroin overdose also tested positive for fentanyl. According to the Center for Disease Control and Prevention, or the CDC, between 2019 and 2020, the number of overdose deaths involving synthetic opioids other than methadone, including fentanyl and fentanyl analogs, rose by more than 56%. So now we're going to take a look into the signs of fentanyl overdose and what you should be looking out for. Sometimes it might be challenging to distinguish between an overdose and someone who is simply very high. The information on how to tell the difference is provided here. It is best to treat the situation as if it was an overdose if you are having trouble distinguishing the difference. Doing so could be the difference between life and death. The signs of overdose include loss of consciousness, unresponsive to outside stimuli, awake but unable to talk, breathing very slow and shallow. For people with lighter complexion, their skin tone can turn a bluish purple, and for those with a darker complexion, it turns a gray or ashen color. It is also very common to hear choking sounds or a snore-like noise, and this is sometimes referred to as the death rattle. Some other signs are vomiting, paleness in the face, their body has gone limp, their fingernails and lips turn blue or purple blackish color, and finally their pulse is slow, erratic, or not there at all. If their pulse stops, then that is very bad, not good. Next, I'm going to be talking about how to handle a fentanyl overdose situation. Learning to recognize the symptoms of an opioid overdose is essential for acting appropriately. First, before you do anything, you want to check the person who is having an overdose. Look for any of the symptoms that I described before. Once you have identified that this person is actually going through an overdose, first thing you should do is call for emergency assistance. If you think that somebody is having an overdose, call the emergency services right away. Do not be hesitant or reluctant to look for expert assistance, as that can save somebody's life. Number 2, administer naloxone. This is a drug that can reverse an opioid overdose. Emergency services will usually be carrying naloxone, and it should be administered as soon as possible. Number 3, provide rescue breathing. Rescue breathing should be used if the person is unresponsive or not breathing at all. Give rescue breaths every 5 seconds until assistance arrives while tilting their head back and lifting their chin. Number 4, stay with the person. You do not want to leave somebody who is in critical condition unattended. Keep an eye on their respiration and keep them awake and alert. Number 5, follow up with support. After the overdose has been treated, encourage the person to seek professional help for substance abuse or a substance use disorder. There are lots of online resources about local support groups, helplines, and treatment resources that should be provided for that person. Number 6, educate and raise awareness. Promote awareness of opioid overdose prevention, early detection, and effective response. Reduce the stigma associated with addiction and promote honest discussion about drug use. Next, I wanted to talk about testing drugs. Before I delve into this topic, I just want to preface that I am not encouraging this behavior. I am simply trying to educate and make sure people are taking proper precautions, as it could save somebody's life. Very similar to sex education, where you can't prevent it from happening, but you can teach people how to be safe about it. The best way to stay safe is utilizing a drug testing kit. Testing kits can be easily purchased and can be the difference between life and death. There are many different resources online and different testing kits that you could buy, but these are very trusted and safe drug testing kits that you can purchase online. It's only like $30 and it could really save your life. So I highly encourage it. Yeah, but that's it. Thank you so much for watching. I really appreciate it. Have a great rest of your day. Bye!